Hey dolls, thank you for tuning in to another episode of Designing Rachel Marie. I am yours truly, Rachel Marie, and we are back with another video. So anyway, today's topic is going to be about prescriptions that you should take to the DR with you if you are having cosmetic surgery with Dr. Duran. The prescriptions that I'm going to provide to you today are based off of Dr. Duran's prescription list that she gives you after you have surgery. So before we get into today's topic, I want to just take this time to thank you guys, as always, for tuning into the channel, liking, subscribing, all of that good stuff. I love all the support that I get from you guys, each and every one of you, the comments, even if it's just a quick thumbs up. Make sure to do that for me. That lets me know that my content is being helpful to you guys. So if you like it, thumbs it up. That way, again, I'm like, okay, I got a good amount of people that are actually feeling what I'm putting out. Cool. Keeps me on the right path. And then also, if you are, watching the channel and you haven't subscribed yet, please make sure to subscribe. That gives me my audience. That helps me, move up to where other people can find me and find my information useful as well. Each one teach one. Share me. And again, I'm going to continue to give you guys everything that I have, all the research that I come up with or whatever. I'll make sure I continue to share and, do what I've been doing for you guys. So basically, today's topic, actually was a recommendation from one of the subscribers. There was a comment left for me maybe a week ago that said, hey, I'm about to have surgery and you've never went over what medicines that I can get prescribed from my PCP prior to going to the DR. And I know this person's surgery is coming up, so I was like, oh, you know what? I'm so happy you brought that up, and I didn't even realize that I never made a video about it, but I'm so happy you brought it up. So now I'm putting out a video so that everybody, can have that information, because I'm pretty sure it's not going to just be one person that needs that. It's going to continue to be people that need this information. So whether you're going to Dr. Duran or you're going to another doctor, you can at least take the information that I'm giving to you from Duran's list and be like, okay, well, if Duran prescribes this, my doctor's list shouldn't be too far off. So regardless of who your surgeon is, this list could be helpful. But again, this list is specifically from Dr. Duran. And here goes the thing. When you're in the DR, and this is what makes it confusing, she does not give you this prescription list until you're discharged from the hospital. So you'll get the list. The list is in Spanish, the entire list. All the medications, everything is in Spanish. So what they call certain medicines in Spanish are completely different than what we call them in English. So you will be completely confused. The only reason that I was not as confused is because I did my homework before I went to the DR. I found another doll, just like me, that had just went over to the DR and had surgery with Duran, and she kindly took a picture of her prescription list and sent it to me. So it gave me the time to really dig in and do the research before I got to the DR, so I could make sure I got all my prescriptions before I came. So for some dolls, they don't have the liberty of doing this, and this is going to help you guys save money, because if you go over there and get that list and take it to the pharmacy, they're probably going to charge you a couple $100. And if you get this stuff filled in the US, I spent less than $100. I want to say maybe $80 tops getting all of this stuff. So you're not going to spend a lot of money getting this stuff, because you're going to be able to run it through your insurance, most of these medications. So let me go ahead and get into the list. I know I have talked a little bit, sorry. So I'm going to give you the prescriptions in the order that they're listed on Duran's prescription list. And I'm only going to give you what they are in English. I'm not going to bother you guys with the Spanish term or trying to murder how to pronounce it, okay? Okay, so the first medication, Omeprazole 40 milligrams. So Omeprazole DR 40 milligrams. I already had this prescription because I developed chronic heartburn from my gastric sleeve. So I have mine in a 90-day script. I take it like clockwork every 24 hours. If I don't, I can feel the difference. My heartburn will come. So for those of you who are not taking it already, this is a stupid simple prescription to get. She recommends that you probably only want to take it, or you probably will need to take it for 10 days. I recommend just having your prescription wrote for 30 days, it's not going to be a difference in price. Just tell your tell your PCP to give you 30 days of it. It'll be one tablet a day for 1 tablet a day every 24 hours. So typically you'll take this at the top of the morning or wherever you may feel heartburn. You may not even feel any heartburn, but if you do, this is why she prescribes this. Most of the time people do feel it because you're going to be so tight internally after the surgery because of the muscle repair. It just feels really, really weird. Your appetite is really, really light, and it's just weird. So again, for myself, I didn't notice the difference because I already had chronic heartburn, but for somebody else, I don't know. But she does prescribe it. So again, number one prescription on the list is Omeprazole, 40 milligram. Use 1 tablet per day, 8 a.m., 1 every 24 hours again. Okay, so the second medication is an antibiotic, and it is Ciprofloxacin. You're gonna use this twice a day for 7 days. So you're gonna get you some Cipro. If you have any type of allergic reactions or anything like that to Cipro, you might want to talk to your doctor about an alternative antibiotic. But this is only one of the antibiotics that she prescribes. She actually prescribes 2. So number 2 is the Cipro antibiotic, and we're moving on to 3. So 3 is your Lovenox 40 milligram. You're going to do, the Lovenox 40 milligram is a shot. I'm so sorry. My video got cut off. I got a phone call. Apologize about that. So anyway, back to the number 3, the Lovenox 40 milligram. You're going to get 1 shot every 24 hours for 10 days. Excuse me. This was the most expensive drug that I had to fill through my prescription list. Out of all the medicines that I had to fill, this one was the most expensive. It cost me around $60 to fill this one alone. All the other ones, like I said, were literally dollars. It wasn't much. But this one is very important, especially after surgery, because you're not doing a whole bunch of moving. This is what prevents you from getting blood clots. This is going to, mine personally, I had administered by the lady that was doing my massages each day. Because I had 1 massage each day. She would also give me my shot when she would give me my massages. I'm not one of those people that I can stick myself with a needle. I can't even look at it. So somebody had to do this one for me. And they normally stick you in your thigh or the side of your hip or something like that. She stayed towards my thighs. She didn't mess with my hips or my butt or anything like that. And she shot me right in my thighs. And like I said, once a day for 10 days, your Lovenox 40 milligram. Okay, so number 4. Number 4 is going to be your pain meds. So now, I said pain meds as general because the pain med that Dr. Duran prescribes in Spanish is called an Oxyar Forte or something like that. And what it is an inflammation and pain pill, and it has codeine in it. So if you were trying to like compare that to a pain pill in the US, you could do like a ibuprofen as well as like a Tylenol 3 or Percocet or hydrocodone, Oxycontin. I mean, like anything that you can use for pain. A lot of doctors in the US are going to be very iffy on prescribing you any type of opioid. So, with that being said, my doctor wouldn't prescribe me any Percocets. She wasn't giving me no hydrocodone. She gave me Tylenol 3. I personally cannot take ibuprofen. She would have given me ibuprofen, but I can't take ibuprofen because I'm a gastric sleeve patient, and that is on one of the do not take medications after gastric surgery, gastric sleeve surgery. So that is a medication that I had to give up a long time ago. So, but if you are not, where you can't take ibuprofen, I definitely recommend ibuprofen, combining that with any other pain pill. But again, your PCP in the US is going to probably act weird about giving you any type of opioid. But if you know anybody that you can get any of that stuff from, go for it. Get that stuff before you get over there, because I actually filled her little Oxy Forte stuff, and that stuff is literally not all that strong. I only filled it because I didn't have a lot of pain pills. All I had was the Tylenol 3 that my doctor prescribed me, which wasn't much. So I wanted to have something else, so I went ahead and filled it. But like, compared to the Tylenol 3, her Oxia Forte stuff wasn't even, like, I didn't even feel them. So again, you can save your money on that and get you some stuff before you leave. I want to say I had like 2 Percocets while I was over there, because it was a girl in my recovery house. She came in like towards the end of my stay, and she had some Percocets, and she gave me a few. And I'm telling you, honey, if I'd have had them the whole time I was over there, I'd have been chilling. Because when I took that Percocet, I got some of the best sleep that I got, like, the whole time I was over there. Like, I was knocked the hell out. I can see how people probably can gain a little bit of an addiction to those, because they literally, they took me out of my misery over there. So if you can get some of those, they'll help you. The 5th thing, it's called on her list Abenitra, I believe. I'm probably pronouncing it based off of U.S. standards, but that's probably not really what it sounds like, but whatever. The comparison to it is going to be Emergen C. So Emergen C is going to be the comparison of this Abenitra stuff. So basically what it is like a little pouch, probably about like that big, with powder in it, and you mix it with water. You got to make it like pitcher size. So you mix it with water, and you're supposed to drink a glass of that a day. All it is like I said, the stuff that's in Emergen C, the vitamin C, all your little vitamins or whatever to help, get you back up to par. She recommends drinking this for 10 days. Another alternative, and if you want to get Emergen C and something else, you can get you some of those Ensure protein drinks, and those have your vitamins and all of that stuff in them, as well as the protein. So you can actually get those, and you can carry those over there as well. Or you can go to the grocery store over there, and they carry them as well. So if you don't want to pack all that stuff and get it, you can buy from the grocery store when you get over there. And this is want to be one of the things that you would need pesos for, because if you're going to go to their stores over there, you want to have pesos in the grocery store, because they don't take the American dollar. You would literally have to go to the Western Union, convert your money over, and then buy your items. But again, if you want to pack light without carrying stuff like the Ensure over there, you could just buy that stuff while you're over there, because you're not going to be bringing it back with you. You just drink 1 a day or 2 a day, or however you want to do it while you're over there, just to make sure you're giving your body back the good stuff that it needs. So that was number 5. Number 6 is called vitamin B12. So she's telling you to take this one tablet twice a day at 10 a.m. and 10 p.m. for 10 days. Vitamin B12, y'all can take vitamin B12 just off GP. Before, after, whatever. It's a B vitamin. It's going to help you get your energy back up and all of that. So she recommends definitely taking it for the first 10 days, but I recommend continuing it, just because like vitamin B12 does not help you by taking vitamin B12. So, just continue to take the vitamin B12. It took me a while to figure out that it was vitamin B12, because when I got the list beforehand and I did all my research on it, it's wrote in Spanish as like Beefer 12. And I could not for the life of me get the definition for Beefer. I kept looking it up and I couldn't get anything. And then when I got over there, I actually filled the prescription, this one prescription on the list, this one in the Abenitra. I filled that in the pain meds, because I didn't know what they were. And so when I filled them and I realized these wasn't nothing but vitamin B12 pills, I was like, bullshit. I could have got those in a little gummies, or, you get them in gummies, you can get them in liquid, you can get them in pill form. I recommend either getting yourself a gummy or a pill form. Do not travel with the liquid, because normally liquid B12 has to be refrigerated, and you're not going to be in any condition to be making sure a vitamin is being refrigerated. Get yourself something convenient and easy. I probably recommend for this, probably the gummy, because you're going to be taking so many pills. Just pills, you're going to be tired of taking pills. So if you get you a little flavorful gummy, it'll add a little bit of a variety to what you're doing, and it won't feel like another pill you're swallowing. Okay, so that's number 6. And then finally, number 7. This is the last one. It is another antibiotic. So remember I told you that first Cipro was the first one. The second antibiotic is Augmentin. You're going to take this tablet once a day for 7 days. So you've got your Augmentin, 1 tablet a day for 7 days. It's an antibiotic. Your doctor's not going to give you any problem getting this. This is a simple thing. It'll probably cost you $1.50, $2 through your, local CVS or wherever you fill your prescriptions, because your insurance is going to basically cover majority of this. This is a simple prescription. So the only things on this list that you're not going to be able to like get filled through a prescription at the pharmacy is going to be like the Emergen C or the Ensure protein vitamin drinks and your vitamin B12. So, but everything else you will be able to get filled by your pharmacy, and you won't have to buy when you get over to the DR. Literally, you're gonna spend under $100 getting all of these things if you get them all in the US, opposed to going over there you might come out of a couple hundred. And then you don't have to worry about transportation to the pharmacy, because believe it or not, they charge you to take you to the pharmacy. So you know, remember, when you go over there, you're gonna be charged for every single thing that you need to do. So if you can prevent any type of extra trips or anything like that, do so, because it's only going to save you money in the long run. Most of these recovery houses, when they say transportation, that is transportation to and from the clinics. Most of the time, that's not anything else. Even if you end up having to do like oxygen therapy or anything like that, typically their transportation does not include that. That is going to be an additional charge. You will have to pay extra to go to extra places outside of normal back and forth from the clinics for your appointments. So I'm gonna go ahead and run through this list really quick for you guys again without going into detail, since I've already done it. So again, if you have not already, grab your pen, a paper, and write these things down. So number 1, Omeprazole DR 40 milligram, 1 tablet per day. So just 1 every 24 hours. Number 2, Ciprofloxacin, antibiotic, twice a day for 7 days. Number 3, Lovenox, 40 milligram, 1 shot every 24 hours for 10 days. Number 4, pain meds, your choice. You can do ibuprofen, Tylenol 3s, Percocets, hydrocodone, whatever you like or you prefer for pain management. Number 5, Emergen C. You can buy this from Walmart. Number 6, vitamin B12. 1 tablet twice a day for 10 days. And number 7, Augmentin, an antibiotic, 1 tablet per day for 7 days. Okay, so I got all of this stuff out. Sorry if I've been looking down a lot, because I always make notes to make sure I don't forget anything. So, what was I about to say? Okay, so yes, if you guys have any questions about any of these prescriptions or anything else, make sure to leave it in the comment section below. I literally read every single one of your comments. That is how I got the idea for this video and realized that I never made a video about it. So I read every single comment, even if I don't have the time to actually respond. Please know that I'm listening to you guys and I am reading your comments. So with that being said, if there's anything that you want to hear from me, or you know, anything that you feel that would be helpful to you or anybody else that's watching it, let me know, because that gives me ideas to continue on what to make videos about and so forth. Also, what was I about to say? I'm so sorry. So we talking about the videos. Also, if you're liking them, thumbs up, that type of thing, so that way I know. I'm trying to think if there's anything else that I haven't addressed so far. So yeah, I think that's it. I'm sorry, y'all. I'm a little tired. I don't know. It's been very, very difficult trying to keep up with my lifestyle. Like, I thought things would get easier after surgery, and it's still as intense as it was before, trying to incorporate the gym to maintain my results and all of that. But I'm gonna do a 4-month post-op. I'm gonna do a 4-month post-op live video. So I wanted to do it different because I wanted to basically give the ground for anybody to ask me questions. So right now I'm a little over 4 months post-op, and so like I said, I wanted to do a live just to kind of let you guys come on and ask whatever questions you have for me at the 4 month of post-op, so that way you know, I just kind of give you guys an update on how I look, how everything's feeling, and just everything. So again, if you guys are not following me on IG, please make sure to follow me on IG. I do a lot of updating on IG. If I don't do anything on YouTube, there definitely is something being done on IG most of the time, because it's a lot easier for me to just post something on IG most of the time. I try to keep myself updated with a little bit of activity at least once a week. But again, you know, I'm a working mom, so sometimes I fall off a little bit. So as long as you guys forgive me, we're good. So again, on IG, I am designing Rachel Marie, just like I am on the YouTube channel. So I've got some new stuff, of course, coming up. I'm so excited, y'all. I can't wait to share it with y'all. I've been holding on to this, but I want to make sure everything is officially in the works before I share with you guys. Make sure everything is official. Continue to stay tuned so I can make sure to give you guys what I've been up to and why I'm so busy. So anyway, if there is anything else that you guys need from me or questions, again, leave in the... Oh my God, y'all. My phone won't let us be great. So anyway, if there's anything you guys are needing from me, leave in the comment section below. I'll make sure that I either respond via with another video or directly to your comment or whatever. And we'll just keep moving like that. So thank you again for tuning in to all the videos and subscribing to the channel. And we'll talk soon. Bye.
Every single day